All right, joining me now is Dr. Ramin Oskoui, cardiologist and CEO of Foxhall Cardiology. Also with me is Dr. Devi Nampiaparampil, a practicing physician, also with Fox 5 in New York. Dr. Devi, in your city right now, there's a clinical trial starting on hydroxychloroquine as a prophylactic and a treatment. 1,500 patients are involved. I certainly hope we get clear and transparent data and preliminary data within days on that.
Well, I'm very excited about this because it's actually looking to see if we can slow the spread of the coronavirus. Now, so far, all of these studies that have come out of France, the ones that have come out of China, they're looking at whether once somebody is sick, once they're in the hospital, can the drug help in terms of treatment, right? But what we really want to do is prevent people from going to the hospital, prevent deaths. And so in this study, this is going to be done at Columbia University Medical Center. They've already registered it as a trial. They're basically looking to see if one person in a family develops coronavirus, can this drug be used for everybody else that lives with that person to try to protect them from developing the symptoms themselves?
Dr. Oskoui, you have addressed this with your colleagues across the country in cardiology and other specialties. Tonight, if you had to advise high-level government officials or frontline military responders, doctors, nurses, given what we know in this current situation, should they all be on hydroxychloroquine with a physician's supervision?
I think the answer is clearly, absolutely yes. Let's look at a few facts. We're not seeing patients with lupus who take Plaquenil, the branded name for hydroxychloroquine. We're not seeing these individuals develop COVID. I'm not aware of any reported cases, and the Chinese have actually looked at this. The second issue is this drug has been around for a long time. Unlike Gilead's drug, has minimal side effects. Its toxicity is trivial. It's very rare that you get a drug which is both safe and highly effective. You enumerated many of the studies that have already been done, but this is a drug that's cheap, it's easily made, it's scalable. I sent you the manufacturing data. I think absolutely our military needs to be on this prophylactically. All you need is a screening EKG before starting. Healthcare workers need to be on it until both groups actually get antibody tested, and we know that an individual who tests positive for the antibody actually is then immune from getting the actual COVID illness. But I think absolutely we need to do it. The problem is volume of drug needed.
Yeah, we have to scale it up. If the president has to use the Defense Production Act to do it, he should do it, because this could completely keep more people off ventilators if intervened with early. So we shouldn't wait to dose it to people. According to all the doctors talking to me, I want to play something from the architect of Obamacare. Zeke Emanuel said this about possible COVID treatments.
Snake oil salesmen come out of the woodwork all the time in these kind of circumstances, whether it's, vitamin C or it's chloroquine or whatever. At the moment, we don't have proof on anything. And so don't take anything thinking you're protected, because that's just garbage.
Dr. Nampiaparampil, you keep hearing this line that we have no proof, but that's absolutely untrue. We don't have a button-down 1,500-person study results yet, but physicians all over the world have proclaimed it is their go-to drug. Do we think physicians are poisoning their patients all over the world, in Spain and Italy and China and the United States, by using this drug? Or is it working? This is insane, what he just said.
Well, I agree. Also, on top of that, actually, he mentioned vitamin C, but people are using that. Doctors are using that also intravenously to help with this drug, ironically. But I will say, comparing this to snake oil is such an extreme statement. So if you're talking about something like appendicitis and somebody wants to do something like vitamin C rather than having an appendectomy, a situation where we have a clear-cut answer, something that will treat the problem, where people really have good results, then that's a little more questionable. What are you selling this patient, and is that a safe treatment option? But in this case, we have to look at the risks. The benefits and the alternatives also. And there aren't a lot of great alternatives, but there is some promise in terms of the benefits. So we should give people choices.
Yeah, I mean, if it's not going to kill you, which it won't, unless you have some complicated heart issue, then you go see Dr. Oskoui. But Dr. Oskoui, really quickly, you have spoken about this, but it's not gotten enough attention. I mentioned it in the open. Hospitals and non-COVID conditions. People are putting off going to get that nagging pain checked. Oh, I got a funny twinge and it's not going away. It turns out to be something serious later. How important is it, again, to keep COVID patients at home, if possible, not coming into the hospital on these kind of treatments?
I think every patient has to be examined risk versus benefit. If you're a high-risk patient, you probably want to get you want to be very cautious about going to the hospital. But at the same time, you don't want to have a heart attack at home. So you need to talk to your doctor and be very upfront about your symptoms. And your doctor should know what the situation is at the hospital. But this is, you shouldn't deny the classic example you gave of a patient whose Parkinson stimulator needs to have their battery changed. My gosh, if that fails, they may fall and fracture their hip. So
yeah, I can tell you. Hold on, I can tell you. I want people to understand. This is not me saying this. This is the vaunted New York Times. Okay, headline: during a pandemic, an unanticipated problem. Out of work healthcare workers across the country, plunging revenues from canceled non-emergency med appointments have forced hospitals to furlough or even cut the pay of doctors, nurses, and other staff. I bring this up because we have to think of the reverberations, the ripple effect this is having across multiple medical specialties and conditions. Doctors, thank you so much. Great to have you on tonight.
Thank you.